hang on. There we are.
Okay.
Yep, there we are.
Okay. So what are we supposed to do?
This is Facebook Live.
Oh,
we are chatting with the world.
Oh my goodness. Oh, hello world.
Hello world. Guys, this is Dr. Wong from Physio U, and I've spent the most precious 8 or 9 hours with Dr. D, who has been teaching for us related to the Rood method, the Rood technique, the approach for rehabilitation. And Dr. D is a world-renowned professor in neuroanatomy, as well as the protege of Margaret Rood. And it's been such a privilege. I've been dreaming all these years of attending Dr. D's course. But today I got firsthand experience to be able to capture the magic and how these things are done, how these techniques can be used to enhance the lives of our patients. And we're so excited to be able to bring it. And Dr. D has a dream also of being able to propagate this.
Yeah.
Did you want to say anything, Dr. D, about this?
It's so important. I just always have thought that Rood technique is too good to get lost. And so I am so grateful to Mike for giving me the opportunity to share with more people, because I couldn't do that any other way.
Yeah.
So I'm
so
excited.
We're so excited, and congratulations to you, Dr. D. I mean, 8 hours is an incredible feat. And we got to piece it all together, all the different techniques, facilitatory techniques, inhibitory techniques, and we actually did a patient demonstration on a post-stroke patient and how to apply these techniques. And that's our dream, right? To help young clinicians, new clinicians, all clinicians, to be able to utilize these different tools for the sole purpose of enhancing the lives of others. And so, Dr. D, congratulations. This is a big day.
Oh, it's a great day.
Thank you for being a part of it.
Thank you.
All right, gang. Cheers to Dr. D. Send your comments and love. And she's an amazing lady. Thank you.
Thank you. To bring the fingers up to work against that flexion. Okay? Interesting. Though we are responding. Is that hurting?
No. I've had somebody do a long time ago paraffin baths to try to release it a little bit.
That was heat.
Yeah.
This I'm talking about is cold.
I know. I like heat better than cold.
I know. Most people do. But I think, oh well, it is what it is. They do release a bit when I put that pressure on. But it's going to take a while to work that through.
Yeah, they've been stuck.
They've been stuck a long time.
They have been.
Yeah.
So you're using deep pressure to get some inhibition.
Yeah, deep pressure for the inhibition, and she responds fairly well at the where the profundus, I mean where the sublimus is. She's very tight at that joint. That it's not the PIP, but it's the proximal IP. But she comes out nicely with the distal one, so that works fairly well on her with the distal. And the thumb will relax with the deep pressure. Okay, I'm going to let you be comfortable for a while. No napping. Okay. Is that hurting?
No, I was just trying to kind of make it comfortable.
Okay.
Find a place for it.
Where it can rest?
Yeah.
Yeah, so it loosened a little bit there, Mike. And the shoulder girdle loosened a little bit. Trying to think of anything else that we could, so I did the brushing. So we need a lot of inhibition in the flexion at the shoulder, flexion at the wrist, elbow and wrist. Well, the wrist is not horrible. The wrist is pretty good, but the fingers are quite flexed. Okay? You okay?
Mm-hmm.
All right. I think Shall I go on to the lower extremity now? Okay. Okay, Kathy. I'm going to bug your bottom end here a little while.
Alrighty.
Okay. And so I'm going to try first to show how much motion we have, easy motion. Okay? And now, Kathy, I'm just going to, you don't have to do anything, I'm just going to do a little pressure into your hip. And go. So a little joint compression. Tell me if I'm hurting you. And let go. You relax, aren't you?
Mm-hmm.
Okay.
It's not what I do best, but I try.
I'm sorry?
Relaxing is not what I do best, but I try. Sometimes it's hard for me just to let it go.
Just let go. Yeah. Yeah. That's a tough job. But letting go is easier than thinking, oh, I gotta relax, I gotta relax. And that takes work.
Yeah.
But let go, just let go. Okay? All right. I'm gonna just bend your knee here. You let me do it. Now you help. Bend and straighten. Good. Bend and straighten. Okay, hold on. Relax a minute here. All right. Okay, I'm thinking, just let go, let me try to inhibit a little bit more. The joint compression works nicely at the leg.
As a way to decrease tone.
Mm-hmm. Yeah. And so I can inhibit some of that higher tone that she has. That's very helpful. I don't know that we'll increase range of motion, but it'll be interesting to see post-wise when we're through, if we see a difference. Okay. This is easy for you to kick out, isn't it?
Yeah.
Pretty easy?
Yeah, kicking out is much easier than pulling back.
Bringing it back is harder, isn't it?
Yeah, much so.
Okay. All right, let's see what we can do. This might feel funny on your lower limb, but here we go. It's not very often that I facilitate hamstrings, but to help her to get the flexion, I'm going to try.
So what dermatome are you focusing on?
I don't have to do dermatome, just
Oh,
muscle.
because you're just doing muscle belly.
Yeah, just muscle.
Which may help with reciprocal inhibition as well.
Yeah. All right, let's bend that knee again. Oh, that's good. And now we straighten it. And now bend. I'll help you. bend again. Not too bad. Not too bad. Good girl. A little bit freer to move. Now, Kathy, I think it'll work, and if it isn't too much trouble for you to go onto your back. Okay. All right. You relax for a moment. There you go. Doing some joint compression again.
With less than body weight
Mm-hmm.
for inhibition of muscle tone.
Uh-huh. The adductors. Okay. Now I'm going to try to see if I can see any active dorsiflexion. Okay? So I'm going to try the vibration again. And I tried a little quick stretch, see if I can get anything. Excuse me, Kathy, I'm going to just put this down a little bit so I can see your sock. I don't have to take it completely off, but
So to improve dorsiflexion,
mm-hmm.
we use the vibration
A vibration.
to facilitate the dorsiflexors.
Uh-huh. And
Quick
try,
stretches.
and trying to quick stretch too, same time
Yep.
for facilitation.
Yep.
And now I'm going to try the vibration again. And I think I can't see it so well, but I can feel it come in.
Yep.
The toe extensor's coming in too.
Mm-hmm.
I'm trying to help her pull up. Oh, you're using all kinds of good stuff, Kathy. I forgot to ask you if you'd had any fractures or any surgery before your stroke.
No, not at all.
Okay. I just remembered one thing we didn't do was tapping.
Again, to facilitate the dorsiflexors,
Uh-huh.
enhance dorsiflexion.
Uh-huh.
Since Kathy has increased tone with plantarflexion, so that's always challenging for mobility.
That's right.
You know, come to think of it, I did fracture my little toe maybe a couple of years before my stroke.
Oh, the little toe on this side?
Yes, I think so.
Okay.
And then maybe had a fracture in my foot another time there.
Okay.
They wanted to cast it, but I talked about it casting it, and I just wore one of the Velcro shoes to get
Okay.
around, which was fine.
Okay. So Kathy, I'm going to try to help you. We're going to bend your knee and bring your foot to the table. I think you can see. When you flex at the knee, puts the gastroc
On slack.
on slack.
So again, to facilitate this dorsiflexion movement, you put one of the restrictors on slack, facilitate the dorsiflexors with tapping, quick stretches, vibration, and try to reorganize the central nervous system.
To get the dorsiflexion to come in
Yep.
actively.
Yep.
Yeah. Does that hurt, Kathy?
Not at all.
By any chance, does it feel a little bit good?
Yeah, it feels good because it feels like it was tight and like you're gently stretching it.
Yeah. And I'm helping it a little bit with this facilitation. And I'm going to do a little more.
So to help with limb clearance and swing.
Yeah. And so it does help.
Yep.
To get some dorsiflexion by getting that gastroc at least inhibited one end.
Yep. Put it on slack. Make it, actively insufficient.
Lovely. Now with
That's
her
partly
leg up in that
passively
position,
insufficient.
Kathy, let's see how you do with rotating that leg. Not too bad. That's pretty good.
What were you looking for there?
I'm just looking to see about her, if she has limitations in internal and external rotation. But with this position, she's fairly free. It's not hurting her. And so that's good. Okay? And so, in this position, with the flexion at the knee, putting that gastroc on slack, that frees her up a little bit.
And so our objective test that we're trying to improve, earlier we did a timed up and go and a 5-time sit to stand.
Yeah.
And these are the techniques that we're using to try to improve those.
That's right.
Yep. So objective measures as well as impairment measures and then managing of the impairments to hopefully improve function.
Yeah. And in a little while we'll see if it works.
Yep. We'll reassess.
And when she goes down into her plantar flexion again. Yeah.
So certainly some of her contribution is tone and some of it is also muscle shortening.
That's right.
So there's the musculoskeletal side and the neuro side, they go hand in hand.
Yeah.
You treat the whole person.
It all goes together.
It all goes together.
Yeah.
There is no neuro patient and ortho patient.
No.
There's the patient,
It's a
the
patient.
client, the
Yeah.
person.
It's a person. A whole person. Is putting socks off and on hard for you, Kathy?
It's not too bad. I mean, after this many years, I've kind of figured out how to do it.
How to do it?
Yeah.
Do you do one of those sock things, or if you figured out your way?
Yeah, I just do it my own way,
Okay.
my own hand.
Okay. Well, I don't know if I showed enough.
I think so.
Are you fairly happy?
Yeah, I mean, for all the things that you're trying to achieve to improve her function, for her hand opening, for extension of the elbow, for the knee,
We covered
flexion.
quite a lot.
We
Yeah.
covered quite a lot, so we can always reassess.
Yeah.
We can do our timed up and go. And
So
our,
let's do.
all right, let's do it.
Okay? Let's see if you are faster. Okay, I'll help you with your shoe. What's the best way to help you?
Probably if I'm up first.
Okay?
Ta-da!
Ta-da! She's up.
She's up and she didn't fall off. Kathy, come back and fix my hair for me.
Yeah. I don't know if I did that the way you used to do it.
Yep.
So we're spending time with Dr. D. Lilly and Kathy, and we're looking at the use of Rood technique to improve function in post-stroke. So this is what we are testing and trying to connect all the different pieces.
The cane is somewhere.
Yep, the cane is over here. So we'll go do our retest. I'll move this out of the way.
Oh, you've got the chair, huh?
Yep, I've got the chair there.
I think I'm going to get you a long tape measure, Mike.
Long tape measure would make it easier, wouldn't it?
Yeah.
Okay.
Thank you.
You're very good. Well, I don't hate to
So we're going to do 118 inches for the timed up and go. Okay, there.
Okay?
I've got my.
I don't need to do the instructions again, right?
Nope. She knows how to do
I
it.
know what I'm doing.
Because she knows what she's doing. She's so smart.
Do we have to do gate belt? Because I can probably go faster without gate belt.
Yep. Well, we should put the gate belt on just in case.
Just in case.
Yep, we should always do that.
What happens when that gate belt's on? Does that do something to you?
It feels like it slows me down because I'm more worried, or a little bit of my concern is making sure that you're coming along okay.
Yeah. If I tell you not to worry about me, would that help?
I can try, but,
Kathy, do you have an iPhone?
no I don't. I have a flip phone.
You have a flip phone. What about Dr. D?
Oh, yeah, I do.
You
have
do?
an iPhone?
Can I use it to use the timer?
Yeah. It's in my, wherever my purse ended up.
I'll go get it.
It's a pink one.
Ah, nice.
It's a girl phone then.
It's a girl phone.
Good for you.
Great thing.
Or whatever the other card was black right here. Yeah, this way you can find it and know it's yours now.
Can you find it?
This purse?
I think it's in,
Or this little purse?
no, that one. That was in this red thing.
Oh, perfect. I'll run the timer for you.
Did I not do that right?
It just needed to be a tiny bit tighter.
Okay.
Then
So
I
we're
can
going to
go
retest
faster.
after we've done our treatment of the tone, inhibition, and facilitation. We're going to retest our objective test. Okay, and go. Good.
Much better?
Yep.
It was
Very
18
good. It was
before?
18 before. It is 14, 15. Good. Well done.
You gonna take it off or
Let's
leave it on?
Do
we
we
gotta do the 5 times sit to stand.
the sit to stand? Do you want it off? Can I leave it off for that? The sit to stand?
Yes.
If I'm right here?
Yep. Well, I mean, you have it on, so you might as well leave it on.
Leave it on.
Yep. I'm gonna bring the chair over first. I'm gonna go right here.
Okay? Yeah,
He's got it.
I'll bring it over.
you can.
Go.
Yeah.
We'll do the same thing. I will measure hands across the chest
5 times.
5 times, and I will stop timing right at the end of when you're fully standing on the 5th time. You let me know. Okay, hands across the chest. And wait 1 second.
This isn't my favorite, by the way, just so you know.
I get it. Ready?
It's not mine either.
Okay, Dr. D, and go.
Okay, go.
1, 2, 3, 4, and 5.
Good. And let me check. Before, we had 1808 and 1365. Nice
Way
work.
better.
Nice
Nicely
work.
done.
Nicely done. All right. All right, guys, we are checking out. This is Dr. D, Lily, and Kathy working with the Rood technique to improve function in post-stroke. It's great.